Hi everyone, my name is Hope Gully and I'm currently a nurse practitioner student at Auburn University, and today I'll be speaking with you about the class of drugs called barbiturates. Now there's only 5 drugs in this class, super easy to remember because they all end in barbital. So first there's pentobarbital and secobarbital. These are our short-acting barbiturates. Then there is amobarbital and butabarbital, which are intermediate-acting barbiturates, and finally phenobarbital is our long-acting drug in this class. All of these drugs can be administered orally, parenterally, or rectally, and they are all widely distributed throughout the body, but mainly to the liver, the kidneys, and the brain. They actually have a very unique mechanism by self-inducing metabolism, so they can actually control the rate at which the body metabolizes each drug, which I thought was so interesting. And finally, they're excreted in both the urine and the feces. So barbiturates actually work on the body to produce CNS depression. That is the main takeaway from the mechanism of action of these drugs. They basically can decrease the sensitivity of the body to internal or external stimuli, and therefore can actually depress the central nervous system. So the indications for barbiturates would be when someone's central nervous system is overstimulated and requires it to be depressed. So indications would be like an epilepsy or anxiety, and can also be used for short-term treatment of insomnia, and can also be used as a pre-anesthetic sedation as well. So since we are depressing someone's central nervous system, we have to be very, very careful as nurse practitioners to both monitor and screen our patients and educate them that in the therapeutic effects and then in the unintended effects as well. So our therapeutic effects of CNS depression basically is they're going to be sleepy, they're going to be drowsy, they're going to have decreased motor function, so they're going to need to not operate heavy machinery, and we also have to hardcore screen these patients for any history of drug or alcohol abuse, history of depression, history of attempted suicide, all of these because our CNS depression is so important to monitor, especially with barbiturates because they have such a narrow therapeutic index, which means that there's a very narrow margin at which our patients are actually at like a safe level of CNS depression. The biggest danger of barbiturates is that we can overdepress someone's central nervous system, leading to coma and potentially death, unfortunately. And so we have to educate our patients in the avoidance of alcohol, which is a CNS depression, and other CNS depressants, such as different medications or prescribed or not prescribed, honestly. And then we also have to educate them on other drug interactions that could happen, such as with other CNS depressants. Barbiturates also interact with beta blockers and hormones and steroids as well, so that's something we really need to watch for with our patients. Major contraindications to prescribing barbiturates for a patient would be if the patient is pregnant. It's a category D drug, so we can't give this to any pregnant patients, and if we have a woman of childbearing age, we have to make sure she's compliant with birth control and on birth control before we even discuss prescribing a barbiturate for her. We also can't give these to kids under the age of 6, and it's contraindicated in patients with decreased liver and kidney function as well. It's a lot of information I just went over, basically, but there's a few main takeaways that I really want to hit hard before this discussion is over. Basically, how I remember barbiturates, the way that I learn best is I need to be able to see a class of drug and immediately, based off of the way that it's spelled or how it sounds, have topics kind of pop into my head. So I'm a big visual person. So we have our barbiturates, right? So when I see this word, I immediately look at the first 3 letters, and it's bar. So what do you do at a bar? You drink alcohol. Alcohol is a CNS depressant, so this reminds me barbiturates cause CNS depression. And then a huge thing that we want to nail when we're talking to our patients is that they cannot drink alcohol, they cannot consume anything that would further depress their CNS system. So what I remember when I look at this is I see barbiturate, bar. It causes CNS depression. We cannot combine this with any other CNS depressant. And a lot of the patient education is centered around making sure that they don't further depress their central nervous system. So that's kind of like a very easy way for me to remember it. And it's kind of a fun little like takeaway thing that'll help with boards and future tests as well, which is big for us. And so finally, patient education, obviously, like I've said a billion times, make sure they don't consume alcohol and no other drugs that cause CNS depression. And then for monitoring, we really need to monitor their blood levels for barbiturates because, like I said, it's a very narrow therapeutic index. So we need to let the patients know that they're going to have to actively be monitored. I would personally, as a nurse practitioner, want them to come in every week or so, and I would never give them over a week's worth of this medication just because there's such a high rate of dependence and potential OD for this. So I hope y'all learned something about barbiturates in this class, and I hope that my little trick will help y'all remember this for the future and for boards.